Hi guys, and welcome back again. My name is Dr. Grace and I'm a family physician currently working in Calgary, Alberta. Thank you for how much you engaged with the last video. If you're new here and you're looking for the last video, I'm gonna put the link somewhere here. But some of you had some follow-up questions on Facebook and here as well. So today I want to talk about the one that I get asked the most, and I've got my trusted laptop to help me again. So today we are talking about the salary and payment schemes, okay? This is a question that I get asked all the time. And when I was living in the UK, I used to hate the answers that I would get because everyone would just say, it depends, it depends, it depends. So let's get into it. How much does a family physician actually make in Canada? Okay, like I said in the last video, this is all very province specific. I am currently in the province of Alberta, so my research and everything that I'm going to talk about today is related specifically to Alberta. I have a brief idea, I have a brief idea of how it works in other provinces, but I can't say for certain because, again, I don't really care enough to go and do some research on that because I don't plan to move anywhere. I'm here in Alberta to stay, by God's grace. Okay, having said that, how much do family physicians actually get paid in Canada, in Alberta? You are not going to believe this. Come closer. Come closer. It depends. Yes, I know. The most annoying answer ever, but I'll explain what I mean by it depends, and I have my laptop here to help me. So, we have two scenarios here. Here's the first scenario of a family physician who sees, say, 30 patients a day on a good day, and you have another family physician who also sees 30 patients a day, okay? This first one, say Lola, let's call this person Lola, and let's call this person, I'm so blank, give me a name. David. Let's call this person David. So this is Lola and this is David. Lola sees 30 patients a day, right? And Lola works 8:30 to 4 p.m. But David sees 30 patients a day, and David sees and David works 8:30 a.m. to 4 p.m. Okay, Lola says only family medicine patients. So your cough, your cold, your chronic illnesses, high blood pressure, diabetes, asthma. Lola optimizes their medications and stuff like that. But you've got David who also does these things, but he also has special skills. So he does procedures as well. So David does lumps and bumps removal. David does IUD insertions. David does some menopausal consultations. You know, David has other specialty skills that he adds to his family practice. David is going to make a whole lot of money more than Lola would, even though they both work the same hours and they both see 30 patients. Okay, so most of Alberta gets paid under what's called the fee-for-service model, which means that everything that you do, they pay you for that service that you have provided to the patient. So if you see a patient for 15 minutes and you only saw them for an ear infection, then you would get paid a certain amount of money. But if you saw them and you say you did a physical and you did a pap smear for them, or you removed a lump for them, or you did like a wart treatment for them, or some minor surgery for them, then you would get paid for that as well, right? So if you don't have any other skills and all you do is family medicine and you see 30 patients a day, you would get paid for that, whereas David would get paid for the specialty services that he is performing. So I'll give you basic examples here. So each patient that is 15 minutes or less, they pay you $39 roughly. So let's say 39.40 cents or something like that. Let's say $39 for the purpose of our conversation, right? So you see an ear infection, you spend 15 minutes or less, and this includes time that you take to see the patient, to do your notes, to research your treatment plans as well. So it may very well take more than 15 minutes. It depends on the patient. So say this patient came in with an ear infection and the dreaded hand on the door approach. I know my family doctors are watching this, but the dreaded hand on the door approach. Oh, by the way, doctor, I've been peeing blood for 6 months or something. So then you have to bring them back into the clinic. Then you have to do another history, so that will take more than 15 minutes. Then you have to do your notes, which also takes some time, and then you have to research what you want to treat them for. So say you're suspecting bladder cancer, for example. You don't know what the guidelines are in Alberta. Maybe you do. You open Up to Date says blah blah and blah. You then go and do blah blah and blah for the patient. Then you decide, oh, I'm going to refer this patient to urology, or then you do your referral. So all of that is paid time, right? That's all paid time. So that ear infection that was 15 minutes and they would have paid you $39 or $39.20 or whatever, now becomes a 30-minute appointment because you've spent more time with the patient and you've done referrals and you've done your research, and now you can bill for that time that you've done. I don't know if that makes sense. Okay, now let's move to David, right? David, like me, so I am now NAMS certified, which means I am a certified menopause practitioner, which is a big thing here in Alberta, because lots of women are going through menopause and they need some help, and some physicians are not comfortable with prescribing and all of that. I won't go into that. If you want some more information on that, then you can ask me. But for the purpose of this conversation, because I am now a menopause specialist, I now take consultations. So the government pays me for that service that I provide as a specialist. Okay? So if somebody refers a patient to me, for me to see the patient as a specialist. So say another family doctor wants you to see the patient who is menopausal, they refer to you. So you bill as a referral, and referrals are $129 per patient. Okay? So if I spend, if it's a complicated patient and I spend, I think the limit is 30 minutes, and I spend more than 30 minutes with that patient, then I bill a time modifier, and that becomes $160. So in 30 minutes or 30 minutes and above, I've made $160 because I have extra skills, but you have made, say you only saw 2 ear infections and each one was 15 minutes or less, that's 30 minutes, then you get paid 39 times 2, which is 80 minus 2, which is $78. Okay, so that's how Lola can make less money than David, even though they're working the same time, but they're just doing different things. So it's the salary scale, it depends. Basically, it depends. If you work in a walk-in clinic as well, you can bill so much more, because then you get volume. So they don't care if you only spend 3 minutes with the patient. As long as it's less than 15 minutes, they will pay you that $39, okay? So if it's a simple ear infection, that will probably take you, 5 minutes, ear infection going on for so and so days, ear discharge, there's no red flags, blah, 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 safety net, I've given them the antibiotics, come back if it doesn't settle after, say, 48 hours or 72 hours, or after the course of the antibiotics, depends on the patient, right? So I can see 3 of that in 15 minutes, right? So they're going to pay me $39 per patient for those 15 minutes. So that will be 39 times 3. Okay, I'm not going to do the math now because I'll just embarrass myself. But you know what I mean? So if you see a higher volume, then you get paid a lot more money, because obviously if I see 50 patients a day and each one pays me $38, that's a lot of money, versus if I see one patient every 15 minutes and I'm only able to see 30 a day. I don't know if that makes sense. Okay, so that's how it can depend, basically. So do you see what I mean by it depends? It really does depend. Also, they will pay you a bit more the older your patient is. So I think the cutoff is 75 years. And then instead of them paying you $39, then they pay you 44 or 45. Can't remember now. But it all adds up, If you see somebody with a plantar wart, for example, they'll pay you the visit fee, which is $39. Then they'll pay you the wart treatment fee, which is, I think, $14 for liquid nitrogen. And if you are able to remove the wart surgically, they pay you for that. So that is like, I think it's like $54 or something, or $55, or let's say $50 for the sake of this conversation, right? You can't cram all the codes. That's just it. There's a perfect website called Alberta Fee was it? Yeah, Alberta Fee Navigator. I'll leave the link down in the description box if you're interested. But that's where you would search for things that you would bill for. So you can't cram most of the bills are like the most number of bills that you use is probably 5. You use 0303A, 0304A, you use 0301AD, then you use 1399BA, which is PAP, and BE, which is just a regular speculum exam. And you don't use a lot of those, but if you do something and you're not sure where this comes in, you can search it on the Fee Navigator and be like, maybe you did a conference call with a family member about their relative whom they're worried about. Then you just do the math. You just put it on the Fee Navigator and it will tell you what bill to bill, and then you get paid. I must warn you though that website is not up to date, so some fees are actually lower than they would be normally, if that makes sense. So like sometimes it will say $15 on the Alberta Fee Navigator website, but when you actually put the code into the EMR, it populates as something higher. So I don't know why they haven't updated it yet, but I don't really care, to be honest. Okay, so that's it about the different salaries. So on average, if you were to work 48 hours a week, a year rather, somebody like Lola would make, say, $300,000. Somebody like David could very well make it to the 400s and 500s. But one part that people don't talk about a lot, especially for us coming from the UK, is the overhead bills. So overhead means that you are renting a space. So it's different in the sense that your patients actually belong to you. They don't belong to the practice. So, you know, in the UK, you could see they just book patients in with anyone. It doesn't matter if they're your normal GP or they're not your normal GP. But here in Canada, you are responsible for the patient. So anyone else seeing the patient for you is doing you a favor. They don't have to do it. And if they don't, then your patient can go to a walk-in clinic if you're not available. So those patients are yours, right? They belong to you. But you need somewhere, you can't see them on the street, right? You can't see them in your house. You need somewhere that is approved by the government as somewhere where you can see patients, you can do procedures. You know, they have standards like it has to be sterile, blah, blah, blah. The examining room has to have a couch and all of that. So then you pay an overhead. So it's like instead of you having to rent a whole building and having to get a whole new staff member and all those things, and having to, you know, be on your own basically, you can go to an established clinic, but you pay them a rent, or you pay them rent to be able to use their space and use their staff for your practice, because it's your practice. You just need somewhere to see them, right? So that's called an overhead. So overhead in Calgary ranges from 20% to 30%. Depends on what you're getting as an overhead, and depends on what they're doing for you. So some places will charge 30%, but they should be doing a lot more than places that charge 20%, for example. I know that it doesn't always work that way, and sometimes we choose these things based on what for example, for me, I chose my current place of work because it works for me right now. It's close to my house and my kids' school, so it works for me, but my overhead may be considered high for some people. Okay, those people would be willing to drive a bit farther into the city because it doesn't matter for them, right? So on average, it's 20 to 30%, depends on where you are in the city and the deal that you've made with them. Okay, so these are all services that are insured by the government. Another way of making money is by providing uninsured services. So the government does not cover some specific services. So like warts on the hands, for example, if a patient wants a wart removed on their hand, that is considered a cosmetic procedure and you can charge for it as a cosmetic procedure. If they want you to fill in forms for their workplace, it's not covered by the government. They will pay special fees for that. If they want a sick note, it's not covered by the government. They will pay a special fee for that. There's like a whole list of uninsured services on the AMA website where they tell you the things that are not covered by the government and you can charge for them. But I would say that's definitely an additional way of making money for sure. Other people have asked about the difference in pay models. Okay, so that model that I talked to you about is called the fee-for-service model, and that's what most people use. I would go as far as saying that most people use the fee-for-service model. There are also two different models which I researched specifically for the purpose of this video. So you guys tell me thank you, because I didn't know about them before. I mean, I knew that they existed, but I didn't know much about them. Okay, so there's a new model. I don't know if you guys have heard. There's a new pay scheme coming to Alberta around April time, and it's supposed to pay for physicians' time that they spend outside of the clinic hours and time that they spend outside of regular clinic hours as well. So like if you work in the evening, they pay you more, and it's supposed to pay us more than what we're currently earning through the fee-for-service system. So it's called the Physician Comprehensive Care Model. Okay, so this model of payments is supposed to include three things. So your panel size, so you get paid for how big your panel is. So the minimum is 500. Anyone above 500, they would pay you based on your panel size. They would pay you based on the time that you spend after hours providing care. So like if you were to work like 5 to 11 p.m. or something, they would pay you extra, and then they would pay you based on the time that you spend doing things outside of clinic hours. So currently through the fee-for-service model, you can only get paid for the services that you provide in clinic and time that you spend doing your notes and all those things. But like say you refer somebody to a specialist, for example. So let's say I refer somebody to ophthalmology, and then ophthalmology sends me something back from that patient, like a consult note, and says, oh, I need you to do this and this and this while we're waiting for this and this and this. The time that I spend reviewing that, right, and making my new notes, I can't bill for that, so I can't get paid for that. Okay, but through this new PCCM model, you can get paid for that. So all the 3 hours that I would spend doing my tasks at home and going through my admin work is now paid time through the PCCM model. So there are a lot of kinks and things are not set in stone yet, but many people are thinking that it might be better than the fee-for-service model. I personally haven't made any decision on whether I'm going to move to that model or not, and I just want them to, there's still a few questions in the air, basically. Okay, now there's another model called the BCM model. Okay, so the BCM model is the blended capitation model. I don't really know what that means. It says it's an alternative to the traditional fee-for-service compensation, blending patient-based capitation payments and volume-based payments through fee-for-service. So I don't really know much about that, and I don't know anyone who uses that model. I don't know anyone. I'm just thinking now, I don't know anyone who uses that model. There's also another model called the CARP model, which is, it's called a Clinical Alternative Relationship Plan Compensation Model. It compensates physicians for providing a set of clinical services at defined facilities to a target patient population. So I'm thinking that it means, because sometimes I've gotten these kinds of job offers in my email where it's like, we are providing family medicine services to a group of teenage, maybe drug addicted patients who are in remission, or you have to go to like a prison. That's what I'm thinking that this CARP model is. But again, I don't know anyone who uses this model. Most people use the fee-for-service model, basically. Okay, so now let's go back to Lola and David in terms of how much they actually get paid, and just not just the numbers on the screen, right? So say Lola gets paid $300,000, right, for the work that she's done in the entire year, and then David gets paid say $450,000, because the difference can be insane. I'm being dead serious here. It can be insane. So if you can learn a skill before you come here, you can still learn them here, but if you can learn a skill, like for me, I did the minor surgery course in London before I came here, and that was really super helpful. I get paid for doing biopsies, like punch biopsy, excisional biopsy, you get paid for that. My point is that I learned that in the UK before I came, and that was super helpful for like additional money. And I learned contraception here in Canada by watching my colleagues and getting them to supervise me, by taking some courses on IUDs that were provided by Marina and some of the copper people and also the Nexplanon people. Okay, so say Lola makes $300,000, right? She has to pay, let's say she pays 30% overhead, for example. So that leaves her with $210,000, right? Out of the $210,000, she's gonna then pay tax from that $210, right? $210,000. But say David makes $450,000. What is wrong with me? $450,000, and he still pays 30%. That leaves him with $315,000, but he still has to pay tax on that, right? So the best way to maximize your tax and everything is, number one, to have an accountant. Number two, to have your professional corporation. Okay, so just like you would have one in the UK for getting paid through a limited company, it's the same way that you would do it here, but the rules are kind of different, and I don't really understand it, and I don't want to mislead you because I haven't actually finished my first year of having my professional corporation, so I haven't done my books and I haven't done my taxes yet, so I don't want to mislead you, so I'm going to leave that part out. But it's possible to save money by expensing some things that you normally would not have, because oh my god, the fees for professional fees are insane. I'm going to make a whole separate video on that one because this is getting really long, but fees are insane and you have to expense everything that you can. So like your stethoscope, your because you work at home, you can expense some parts of your bills, just like in the UK and all those things. So your company is very helpful for doing that. So that's a way that you can save money. Okay, so that brings me to the end of this video. I've tried to answer the question as best as I could with the information that I have. But the truth is that it really just depends. And if you can acquire special skills, then do so, okay? Because that will net you a lot more money and you will talk less because you see less patients basically and make the same or more amount of money. So let me know if this was helpful. Let me know if you have any other questions. I'm happy to make these videos. I've gone through so many things so that you guys don't have to. So I'm very happy to share the knowledge that I've gained in the last year that I've been working here. And I will see you in my next video, which will be about send provision. A couple of people have asked me about send provision, and I'll just tell you what I know basically in the next video. All right, bye.